The urinary tract includes the kidneys, the bladder, ureters or tubes that carry urine from the kidneys to the bladder, and urethra, the tube that carries urine from the bladder to the outside of the body. What are urinary tract infections? Urinary tract infections, also called UTIs, are infections that affect either the bladder or the kidneys. Bladder infections are more common than kidney infections. They happen when bacteria get into the urethra and travel up into the bladder. The medical term for bladder infection is cystitis. Kidney infections happen when the bacteria travel even higher up into the kidneys. The medical term for kidney infection is pyelonephritis. Symptoms of bladder infection include pain or a burning feeling when you urinate, the need to urinate often, the need to urinate suddenly or in a hurry, losing control of your bladder, as well as blood in the urine. The symptoms of a kidney infection can include the symptoms of bladder infection, but kidney infections can also cause fever, back pain, nausea, or vomiting. How do you find out if you have a urinary tract infection? Your doctor might do a simple urine test. If he or she thinks you might have a kidney infection or is unsure what you have, he or she might also do further evaluation. Most urinary tract infections are treated with antibiotic pills. If you have a kidney infection, you will probably need to take antibiotics, and it is also possible that you will need to be treated in the hospital. Your symptoms should begin to improve within a day of starting antibiotics. What if I get bladder infections a lot? First, check with your doctor to make sure that you are really having bladder infections. The symptoms of bladder infection can be caused by other things. But if you are really dealing with repeated infections, there are things you can do to keep from getting more infections. These include avoiding spermicides or sperm-killing creams, drinking more water, urinating right after sex. Some doctors think that this helps because it helps flush out the germs that might get into the bladder during sex. There is no proof it works, but it also cannot hurt. If you are a woman who has already been through menopause, your doctor might suggest vaginal estrogen. If you get a lot of bladder infections and the above methods have not helped, your doctor might give you antibiotics to help prevent infection. The studies suggesting that cranberry products prevent bladder infections are not very good. Other studies suggest that cranberry products do not prevent bladder infections. Thank you for listening. Please click the like button, subscribe to Diseases Simplified, and ring the bell for more health tips and updates.